In this video, I'm going to discuss 5 symptoms to never ignore in your chest.
Does your chest hurt?
Chest pain is super common. Don't ignore it, even though most of the time it's most likely not anything serious. But heart disease is still the #1 killer in the United States, and even uncontrolled asthma can lead to lung transplantation. Now, it's super important to get professionally evaluated by a medical doctor when you have chest pain. There are so many different organs in your chest, and when tissue is injured or when it's dying, your body will have symptoms of pain asking for help. So whether it's a blockage in your heart vessel or a blockage in your lung vessel, a sore muscle, or an anxiety attack, you should get to the root cause to have a solution. Sometimes when chest pain is from the heart, you may also feel other symptoms like shortness of breath, sweating. You may feel sick or nauseated. It may spread down your left arm to your back or even up your neck. Have you heard of John Ritter? He died of an aortic aneurysm. Grant Wall died of a ruptured aortic aneurysm. He was 29 years old. They both had similar undiagnosed diseases. It really was devastating. Their first symptom was their last. Now, you have this giant blood vessel called the aorta leaving your heart, and every day, if it undergoes a lot of stress, you can weaken that wall, allowing it to be torn apart with the next high blood pressure. And that's really what happened to Mr. Ritter and Mr. Wall. And this is why blood pressure needs to be normal, and you need to check it all the time. When you see a doctor for chest pain, they will ask for a history, take your vitals, do a physical exam, and they may perform these tests like an EKG, cardiac enzymes like troponins, BNP, and procalcitonin, as well as send an imaging scan. Well, just know that a chest x-ray can't diagnose a problem with the aorta, and you really need a CT scan, an MRI, or even an ultrasound that has a machine go down your esophagus. Now, sometimes you may feel burning, which you may experience after eating a fatty meal or when you lie down. You may even taste acid in your mouth or even flavors of your last meal. You're having reflux, and this may be due to slow emptying of food from your stomach called gastroparesis, where the nerves are not functional, maybe due to narcotics, poorly controlled blood sugars, or blood pressure. Really, all these things lead to nerve damage. You also have a door that it goes between your food pipe and your stomach. It's called the esophageal sphincter. And when that gets nerve damage, or when you eat foods that actually cause it to open, like cold temperature food and drinks and caffeine, the acid goes up from your stomach into your esophagus, burning that food pipe, irritating your esophagus. If this happens long enough, you can get ulcers and possibly even cancer. You can take an antacid and your symptoms may improve. However, it doesn't address the root cause, and the antacids will eventually come with side effects, reducing your absorption of nutrients like vitamin B12, disturbing your gut microbiome, and increasing your risk of pneumonia. If you don't have chest pain or reflux, but you may feel tightness in your chest, that's still abnormal, and every disease I just talked about can cause simple tightness. When you don't get enough oxygen, your airway, let's say like asthma, reactive airway, or you have an allergic reaction, let's say to a bee sting, you may only have minutes to address this. It may be a medical emergency. And so this is why you need to have that controlled. I know some of my friends don't want their kids to be on inhalers, yet their kids are constantly coughing and tired. And I bet they feel tightness, but they just can't express it. The problem is reactive airway or asthma causes tissue damage, and that may be irreversible. So if you have asthma, or if you're taking care of someone with asthma, it's important to do 3 things. Remove the triggers, learn to use a stethoscope, and use your prescription medicines when you have to. And oftentimes you need both an allergist and a pulmonologist to help you manage reactive airway disease or asthma. Get to know your airway with a stethoscope, because by the time you can hear wheezing with your naked ear, that's pretty bad. Prescription medications also, they do come with long-term complications, and to minimize that, rinse and spit your mouth after each use of your inhaler. Sometimes people complain something is stuck in their chest, and it could be simply because they're not chewing their food well, especially meat, which is a huge choking risk. However, you can have an infection in your food pipe that could be really easily treated. You can have spasms in your esophagus that may need some potassium or magnesium or something else, or you can have a mass that causes a blockage. And so we need to look inside with the camera to make that diagnosis. I know people who have swallowed fish bones, steak, or even a battery that got stuck in their food pipe. None of those are good because all of them can erode through the esophagus, cause massive inflammation, as well as infection in your chest cavity, destroying tissue that can lead to more complications. So even if you have none of the above symptoms, just understand shortness of breath. If you're short of breath, you need to see a physician. We all know viruses and bacteria can cause it, but heart failure, urinary tract infections, really anything that makes the body feel bad can cause you to be short of breath, and you may need a workup. Just make sure you get your vitals taken, like your blood pressure, your heart rate, your pulse ox, your temperature. And if your doctor is worried, you'll get some more blood tests, like a complete blood count, comprehensive chemistry panel. You may get cardiac enzymes, blood cultures, as well as an EKG, a chest x-ray, a urine analysis with reflex culture. And these things may help your doctor. These are just some of the most basic tests that your doctor may want, but they may do other tests. If you like this video, please join me on my next one. See you there.